opportunity to present our findings on the treatment outcomes of young cervical cancer patients treated at our institution. I have no declaration. Now, cervical cancer is the leading cause of cancer-related death in sub-Saharan Africa. It's the second most common cancer affecting women in South Africa. There are very well-established poor prognostic factors that influence its outcome to treatment, but the impact of age is less well-researched. There is very limited data on the treatment outcomes for young cervical cancer patients, and it's against this background that we embarked on this project. We aimed to describe the 2-year overall survival rate for young cervical cancer patients treated at our institution, and we also looked at describing the demographic features as well as determine the prognostic features associated with overall. So we did a retrospective analysis. We included all the patients that were histologically confirmed, that were less than 39 years of age, and we reviewed adequate medical records from January 2015 to December 2017 and calculated the survival rate from the first day of radiotherapy to the essential day. Let's quickly look at the results. Our study revealed that the majority of our patients were between the ages 30 and 34 years, and that quite a proportion of them presented with very advanced disease, representing about 65.2% of the entire cohort. We found squamous cell carcinoma to be the most common histological subtype among this cohort, and the proportion of our patients were HIV positive, representing about 35.9% of the entire cohort. The treatment parameters: 69.6% received primary chemoradiotherapy or just radiotherapy alone, and we had 6 patients that were treated with adjuvant radiotherapy after primary surgery, and 22 of our patients received palliative radiotherapy. We're glad to report that quite a good number of our patients managed to have at least 4 cycles of weekly platinum-based chemotherapy concurrent with radiotherapy. Looking at the 2-year overall survival rate by treatment intents, for those that received primary radiation or radiation alone, recorded a 71.8% 2-year overall survival rate, and those that were treated adjuvantly, 80% of that cohort survived. Sadly, none of the palliative patients managed to live up to the 2-year break that we had our study period. And looking at the overall survival for treatment intent, so we saw that there was an improvement in survival for those that had early disease compared to those that had very advanced disease, and that HIV status as well as age substratification did not impact on a 2-year overall survival for this cohort. We conducted a multivariate analysis for confounding variables and actually found that the number of chemotherapy cycles impacted on overall survival for this cohort. For those that had got more than 4 cycles of chemotherapy, did way better than those that had less than 3 cycles of chemotherapy. Stage as well as HIV status did not have any impact on overall survival. So in discussion, we recorded a 71.8% 2-year overall survival rate for the patients that were less than 39 years. This was a marked improvement compared to historical studies, specifically done by Professor Simons in the same institution, where she recorded a 59.1% 2-year overall survival rate at the same institution. This is probably improved due to improved treatment protocols for cervical cancer in our department, and also advancement of the technique that is employed to treat our patients in our institution. Like previous studies, we recorded no survival differences between those that were HIV positive and those that were HIV negative, and found that chemotherapy cycles were actually related to outcome, and more so those that had less than 3 cycles of chemotherapy did way poorer than those that had more than 4 cycles. Squamous cell carcinoma was predominant. This was in contrast to previous studies that have associated non-squamous histology of cervical cancer to young patients. Our study was limited by the fact that it was retrospective at a single institution with potential to have limited information due to poor record keeping. The post-treatment assessment was based on the clinical acumen of rotating clinicians, But we're glad to report that this is one of the few studies that is reported on overall survival for young patients, and that it was conducted at an academic unit with consistent standard of care of treatment for all patients. We concluded that younger patients had a higher adherence to treatment, and that the number of chemotherapy cycles was a very significant prognostic factor. And HIV status, like reported previously, had no significant impact on overall survival. We will follow up this cohort for further characterization of prognostic. I thank you very much.